Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions perform between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, and pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head in the baby that size is about the size of a large plum. Can't see it, but you've pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times. Sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.